Welcome to On the Beat, everyone. Well, I'm over here with Dr. Griffin from Griffin Center for Cosmetic Surgery, and today, guess what? We're talking about otoplasty. Welcome to the show, my friend.
Thank you.
Okay, I think this is one of the most important conversations to have because a lot of people think, Dr. Griffin, cosmetic surgery is for people who are vain, correct?
That's what most people
And
think,
it's
indeed.
not. And we're talking about otoplasty, and let's discuss it in kids. For everyone at home, let's dumb it down. What is otoplasty to begin with?
Otoplasty is a description of ear surgery that's corrective in nature.
Yes.
And the thing that we see the most, or the procedure that we do most for this, is children with big ears.
Yeah.
They suffer a great deal of ridicule because of this.
At what age would one start considering otoplasty?
Well, the ear is almost completely formed by the age of 7.
Okay.
So you can do this quite early. And in regard to your comment about the ridicule, parents tend to be the last ones to know. They'll say, it doesn't bother my child.
Wow.
It does. Your
Yeah.
child is not telling you because they do not want to disappoint their parent.
Yeah, and it's just something that I think it's a great conversation to have. You were saying that the ears stop growing at about 7, correct?
Right.
All right, so around about 8, 9 is a good time to maybe bring them in and have a consultation?
5 or 6 is a good time to start
Really?
the talk. And then by age 6 or 7,
all right,
you can do the surgery.
Okay, well, let's bring up our first image, Will. Now, we're looking at the back of one of your patients and the back of her ears. What am I looking at?
What you're observing there is a condition that we call conchal hyperplasia. And that is the cartilage in the ear has overgrown and pushed this portion, which is called the helical rim, outward.
Okay.
So it's too much cartilage in the bulb of the ear.
All right, so let's bring up the other picture, which is face on, and it doesn't look as severe as what it does from the back.
Right. From the back side, you can see that whole conchal
chunky
bulb, whereas from the front, it's still quite large, but not quite as obvious.
Okay, so what type of procedure did you do on her? Let's look at the after picture.
What I did for her was a procedure where all the incisions are made from behind the ear.
Yes.
And we go in and take out a large part of the cartilage and then reposition the ear closer to the skull.
Okay, now let's talk a little bit about the surgery. How long would it normally be taking?
It takes about an hour per side.
Wow.
About 2 hours.
Botox and injectables take longer than that sometimes. Let's talk a little bit about the downtime, because I have been told otoplasty can be a little bit of pain afterwards.
They wear a head wrap for 3 days, and there's some sutures we call bolster sutures that stay in for 2 weeks.
Right. Okay, that's it.
Yes.
But what about ongoing care? Is there a lot of protection? No damage down the road if you're playing sports or really?
Not any increased risk.
Dr. Griffin, I do want to talk very quickly about the Griffin Foundation. What is it for people out there?
Well, I've seen over the years such a traumatic impact that this has had on children. I've seen children for other reasons and their parents just could afford the procedure. So I've started a foundation. It's early in the formation, but we're going to do ears for underprivileged children.
You're amazing. You're going to come back and talk more?
Sure,
We
I'd love to.
appreciate it. We appreciate it. If you want to find out more about otoplasty or this amazing man or the Griffin Foundation, there's all the information up on your screen right now. Griffin Center for Cosmetic Surgery is the place to go when you need that little bit of a confidence boost, or maybe your kids do too. Give them a call. Back after this short break.